like to introduce you to our didactic presenter, Miranda Gray. Miranda is an experienced behavioral health professional with over 15 years of progressive leadership in community mental health, program management, and quality assurance. She currently serves as the Program and Quality Director at the Fairfield County ADAM Board, where she leads a multidisciplinary team and oversees treatment, crisis, recovery, and clinical service systems across the county, while strengthening relationships with community partners. Before joining the ADAM Board, Miranda spent nearly a decade with a community behavioral health organization where she advanced from clinical case management to leading supported employment and community support programs. Miranda successfully implemented the first evidence-based employment program in Fairfield County for individuals with mental health challenges. Deeply committed to community wellness, Miranda serves on multiple county coalitions, including leadership roles with several of them. Her career reflects a longstanding dedication to strengthening recovery supports, improving service quality, and advancing mental health outcomes for individuals and families. Welcome, Miranda. We're really excited to have you here and learn from you.
Thank you so much, Sarah. Can you all see my slides? Wonderful. So thank you so much for that wonderful introduction. As Sarah said, my name is Miranda Gray. I'm the Program and Quality Director at the Fairfield County ADAM-H Board in Fairfield County, Ohio. Thank you so much to our partners at Ohio University for allowing me the opportunity to speak with you all today. As Sarah said, I've been working in the field for about 15 years, and I just want to highlight really where my passion came from. As Sarah mentioned, I spent some time in supported employment, working in the evidence-based model of individual placement and support. And that model is focused on helping individuals who are diagnosed with serious mental illness to gain and maintain employment. And working in that program really allowed me to see firsthand just how work plays such a critical role in the recovery of folks that I quickly became very passionate about the right to work and employment for all. So that's just a little bit of background on me. Of course, I'm not here to talk about myself today. Today, we're going to talk about how to guide employees to the right care at the right time when it comes to behavioral health. So as managers and HR professionals, I know that sometimes we might feel ill-equipped to handle conversations about employees' mental health, substance use, or emotional distress. And these conversations can sometimes feel very difficult and maybe even daunting to some if you don't feel prepared. So as a manager, if this is uncomfortable for you, you may find yourself avoiding a very important conversation. We may feel like we don't know what to say during those potentially difficult conversations about behavioral health. So today, in just 20 minutes, we are going to learn how to stay within our role, listen effectively, and connect employees to the right supports without trying to be or feeling like we need to be a therapist. So let's go over our learning objectives today. So again, we're going to apply our professional boundaries. We're going to learn how to use non-judgmental communication, active listening, and appropriate referral to navigate those behavioral health conversations with confidence. We will identify some available resources. So I'll encourage you all to get to know your organization's behavioral health tools. This could be an employee assistance program, health plan benefits, or maybe even some community referrals and resources and how to access them. So let's briefly touch on why this matters. Why are we talking about behavioral health and our employees? First, we need to recognize that mental health challenges are very common. So about 1 in 5 adults experience a mental health condition each year. Depression and anxiety are the most common. And as managers, we are often the first to notice changes in behavior or performance. And that's really because people spend much of their time in the workplace. And so, as managers, we are often the first to see when something might seem off with an employee. We might notice some work performance changes like lateness, social withdrawal, maybe missing deadlines. Those could be signs that something that we need to pay attention to with our employees. The well-being of our employees is not only important because we truly want our employees to feel good and be well, but employee well-being directly impacts productivity and performance at work. A supportive and engaged workforce contributes to a positive workplace culture, creates a healthier community overall. So, by becoming more comfortable having these conversations with our employees, we are also creating an environment where employees feel safe, respected, and heard. And this can help to reduce or decrease the stigma that may exist in some of our workplaces. And then, in turn, invites more employees to be open and honest about their behavioral health challenges that they might be experiencing. So, what is our role as an HR manager or supervisor? And this slide is going to help us understand what that looks like and what it doesn't look like. And so we'll talk about each one of these a bit in length, but for now, we will just walk through the list on the left. Our number one job as a manager or a supervisor, HR professional, is to notice, to observe. We just want to notice any work-related changes in behavior or performance. Once we have noticed something, we want to check in with our employee using non-judgmental communication and empathy. Our next step, we will share available resources and support options that we might have for an employee. And then we might need to take it a step further if our concerns escalate or behavior escalates. We may have to make some other types of referrals to ensure employee safety. So we'll talk about those in the future slides. Let's direct our attention to the right side of the slide under clinician's role. And let's talk about these. So when I say clinician, that could be a therapist, a psychiatrist, a psychologist. Any of those individuals are clinicians. Clinicians may diagnose mental health conditions. We are not diagnosing. We are just using our noticing skills. So it would not be appropriate for us as a manager to, tell an employee, I think you have depression or I think you have anxiety. That's not our role, and we want to try to stay away from labeling. A clinician can also provide ongoing treatment and maybe prescribe medication if that's appropriate for the person. Clinicians can manage acute crises and do safety planning with individuals if that's necessary as well. As HR professionals, managers, supervisors, that is not our role, and those are things that we aren't going to do, so we won't really talk about those today. All right, so step one. Step one, again, is using our noticing skills. So this slide has some examples of some signs and some symptoms that we may notice with our employees. It's also important to note that signs and symptoms are different. So signs are things that we can see or that we can observe. Now, symptoms are different. We might be able to see or notice symptoms, but we also may need to rely on a person, our employee, to tell us that they are experiencing these things. So the list on the right, those symptoms may be, what we hear from our employee when we do our check-in, which is the next step. The sooner we notice that something has changed, a work issue, a performance issue, the sooner we can intervene and be able to support our employees in a timely manner. And, possibly before things escalate or if they're, before their behavioral health challenge worsens. So any change in behavior or work performance is something that we should be paying attention to. So again, going back to those examples, if you have an employee who is usually on time, isn't out sick much at all, is always meeting deadlines, and that person is calling in sick more and has missed some deadlines, and this becomes a pattern of behavior, we should be recognizing that something may be going on with them and intervene with a check-in. So also I want to mention this list is not exhaustive. So it does not include everything that we may notice as managers, but this is just really meant to give some examples. So any change in work performance or behavior, or even an employee's physical appearance, if their hygiene is typically good, or if they're usually dressed up and then you notice that they're, not as put together as they typically would be, that might mean that they are, going through something and might be experiencing a mental health challenge. So once we have noticed that something has changed, we need to check in with that employee, and we have a few considerations before we do that. We want to choose a time to initiate the conversation when we can provide the time and support without distractions and in a private setting. And I know that can be very tough to do when we're all very busy, but it is very important. So obviously, we shouldn't be having these private conversations where others can overhear, other staff can overhear while we're in a staff meeting, while we're trying to check our emails, answering the phone. Those are things that we do not want to do while we are trying to have this very important private conversation. We want to be able to give that employee our full attention. Language also matters, and I mentioned this earlier. We want to avoid using labels like depressed or anxious. Remember, we are not diagnosing, we are just noticing. We also want to avoid dismissing their experience, like saying something like, everyone feels stressed out, which, hey, that might be true, but it is not helpful to say to an employee who's going through something. Another example on the slide of what not to say is just snap out of it. While we aren't diagnosing, we know that behavioral health disorders can be complex. They might require treatment. And we know that it's not just as simple as, just snapping out of it to feel better. Behavioral health, it just does not work like that. Instead, we want to lead our conversations with our observations. So going back to those noticing skills, you want to focus on what you've observed. So saying things like, I've noticed some changes recently and I want to check in with you. Or I've noticed that you haven't seemed like yourself. Is everything okay? Using those I statements is a great way to start the conversation. And I statements also allow us to express our concerns without blaming a person, without conflict, and helps also to reduce defensiveness. We want to also ask open and gentle questions. So how are things going for you right now is a great question that we could lead the conversation. Avoiding those close-ended questions because they don't invite conversations. You can use statements like, tell me more about that, to stay engaged in a conversation with an employee. Okay. So I mentioned when we first got started that sometimes, we may feel like we avoid these behavioral health conversations because we might worry about what to say or what not to say if an employee tells us that they are struggling with something. The good news is that we don't have to worry about that. We don't have to worry about what to say because the most important part is listening. Listening is going to be our superpower. Remember, we aren't therapists and we aren't here to problem solve. We just need to hear. So a few points when it comes to listening. You want to be an active listener. So what that means is, using those verbal and non-verbal cues to show that we're listening. So be mindful of our body language when we're having our conversations. You want to appear open and welcoming for a conversation and not closed off. You can use things like maintaining that comfortable eye contact, and if possible, use other types of you know, positive body language or positioning. So if you're trying to have that conversation, maybe if you can sit next to the person instead of, across the desk, between having a desk between you and that person might help to reduce some of that sort of power dynamic and invite more open conversation. Another way to show that you are engaged is by paraphrasing. So an example on the slide is that you can say, what I'm hearing is, and then just simply repeat back to them what your understanding is. You also want to, and it's very hard, be comfortable in silence. So silence is okay. It can be a very powerful nonverbal cue. It gives that person space. It gives them time to think about what they'd like to say and really allows them to lead that conversation. Again, we're not trying to problem solve. We don't want to give advice. It might be hard for some of us to resist doing that, but giving advice is not a very helpful approach. And that's not our role as an HR manager or supervisor. We can instead use simple statements such as, I am here for you, you are not alone. And those are more meaningful and supportive. So try to resist that urge to give advice and replace with those really simple statements that just show a person that you care and that you'll be there for them. Another important piece of active listening is really to know your employee. So you want to, know what makes that person comfortable or uncomfortable. And that might even mean that you have to use some cultural considerations. Eye contact is a good example of that. Maintaining eye contact is not acceptable in some cultures, and it might make a person uncomfortable. So just being mindful of those cultural considerations when you're having these conversations is important. So this slide also has some information about when it may be appropriate or necessary for us to refer the employee. And we're going to talk about that a little bit more in length, but just to highlight what's on this slide. If a person, as an employee mentions that self-harm, harm to others, or they're having some suicidal thoughts, the National Suicide Prevention Hotline would be the best referral in that case, and that's 988, and that's available across all communities. If a person has ongoing distress that lasts beyond a few weeks, the duration of symptoms is, often a determining factor on, if someone might need some professional treatment to overcome a behavioral health challenge that they're experiencing, because it might mean that they have a diagnosable condition that they really need some professional assistance. Or if the employee mentions that they'd really like to talk to someone about what they are experiencing, that's an opportunity to also make that referral. Because again, our role as a manager, we're not here to, provide that. We want to provide ongoing support, but in our role, we're not having those clinical conversations. So this slide highlights the 3 tiers of behavioral health resources that most of us, if not all of us, have access to. At the bottom of the pyramid, we have EAPs, employee assistance programs. We have health plan benefits and community referrals, and those are going to be our 3 key options for what type of behavioral health resources that we are going to be considering directing an employee to. Every employee situation is different, so knowing which resource helps you knowing the resources will help us to know how to respond quickly and with confidence. So We'll take a look at each option a little bit in depth. So employee assistance programs. As a supervisor, HR professional, the EAP is really going to be our first line. They're free, confidential, and they're typically pretty fast. So employees might be able to make a phone call today and have a session tomorrow. As a manager, you will never know if your employee utilized the EAP because they do not report back to employers. And having that confidentiality between you and that employee really helps to build trust and makes them more receptive to seeking that care that they need. So just make sure that you know how to access the EAP so that your employees will know how to access the EAP if they need it. It might be just as simple as a phone number that they can call, or I've seen some that have an online request form the person can fill out to either request an appointment or schedule an appointment. And what's great about EAPs is they might also cover more than just the employee. So your household members, a spouse might also be able to access the EAP resources. All right, next we've got health plan and community referrals. So for ongoing care, the health plan benefits are going to be the best resource. So those health plan benefits can typically cover therapy and psychiatry, which are just two options for, treating a behavioral health concern. As a manager, we do not need to know which option is best for the employee or make a suggestion on which is best for the employee. Again, that's outside of our role, and you'll rely on the behavioral health professional to be able to make that determination, or the person, they get to make that determination on what kind of care they'd like. The simplest path, I think, to access the health plan benefits or to know which provider to seek is call the number. Call the number on the insurance card. Ask them for a list of in-network providers. Many plans also now offer telehealth therapy, which can typically be accessed pretty quickly and also offer some flexibility in scheduling. Because a therapist might be located in another time zone, in another state, be able to offer some of those non-traditional hours to the employee that works best for them. For those employees that don't have insurance, because not all of our employees might participate in our health plan benefits, we need to know which community resources or community referrals might be necessary or helpful for that employee. This could also be for employees that have health plan benefits but might not be able to afford their copays. So in Ohio, we have county Adam H boards, and that's where I work. We have a board in every county in Ohio. So many mental health and recovery boards can offer either, sliding fee scale, which reduce the cost of treatment for a person, or might even be able to offer free treatment for individuals within a certain network of providers. If you're listening in from another state and you aren't familiar with what your local community has to offer, a good starting point for you would be the SAMHSA helpline. So the helpline would be able to help you identify some local resources that you could access or help the employee access. And then, of course, NAMI is listed on there as well. NAMI is the National Alliance of Mental Illness, which also offers some good resources for persons experiencing mental health challenges, but also family members of persons who are experiencing those mental health challenges. So it's nice to have options, and we've talked about a few. And sometimes we might not know which is the best resource, and that's okay. This slide could be your cheat sheet. So the slide sort of lists the different options that we talked about, the EAP, the health plan benefits, and the community referrals. One thing I want everyone to remember or consider is concerns about harm to self, others, or suicidal thoughts. If an employee expresses those things to you or you have those concerns, those should be treated as an immediate help might be needed for that person. And so 988, or if you have a local crisis line, would be really the best option at that right time. So we'll go over real quick. I know we're coming up on time. Our 4 steps to remember. So number 1, we want to use our noticing skills, initiate that private conversation to engage our employee. Number 2, again, we want to listen non-judgmentally and be an active listener and engage in that conversation so our employees can see that we really care. Number 3, stay within our boundaries, know our role as a manager, HR professional, supervisor. We're not here to problem solve. We're not here to be therapists. And then number 4 is refer. So use that pathway decision guide from the last slide to help you make a decision if you feel like you need some help. And I do have a number 5. It's not on the slide, but something to remember is always refer to your organization's policy and procedure. So I'm just giving some tips today, some tips for communication, but your own organization's policies and procedures should really precede any of my suggestions today. So I do have a little call to action. It's an easy one. One thing I'd like to recommend everyone on the call to do is just take a moment and locate the resources that we talked about, write them down so that you are prepared and have that information ready to go when you have your next behavioral health conversation and with an employee. And this will help you feel capable and confident. So that's my information for you all today. I do have a recommendation. If you or your organization would like further training about how to help a person who might be experiencing a behavioral health challenge, there are 2 evidence-based training programs that I would recommend. Mental health first aid is one, and QPR, which is question, persuade, refer. These are really good resources that give you step-by-step sort of directions how to help a person who might be experiencing a mental health challenge or having some suicidal thoughts. But you can locate both options for training either on those websites, or if you're in Ohio, connect with your local ADAMH board, and they will also be able to help find those resources for you or your organization.